Hey guys, it's Jameson. All right, so for Unit 4, we're going to get into cancer. Here's your objective straight from your textbook. We're going to kind of discuss some of the statistics of cancer, how the immune system relates to it, that sort of thing. So first off, what is cancer, right? We hear it, we kind of know. Basically, it's a group of diseases, right? Um, Basically uncontrolled and unregulated growth of cells that happens within this group of diseases. Cancer is considered a disease of aging. Most of the cases are diagnosed in people over the age of 55 years old, and it is the leading cause of death for individuals aged 40 to 79. There's 1.8 million new diagnoses every year in the US. Men are more at risk for both incidence and mortality from cancer, although women have a higher incidence in early adulthood, so like 20 to 49. It's the second most common cause of death in the US, but we have noticed that both incidence and mortality rates are declining. And that's because we've been really pushing some preventative measures that help with some of the cancers. So like lung cancer, how we quit smoking, using sunscreen to prevent skin cancer, that sort of thing. For our biology of cancer, there's two major dysfunctions for cancer to develop. It's either defective cell proliferation or defective cell differentiation. I do want to preface this section that we're getting into, so on the pathophys of cancer. Cancer is a confusing disease, and there are so many different kinds and types. I'm trying to generalize it so you have an idea of it, but this isn't something that I want you focusing on memorizing. This is more, it kind of helps you give a more well-rounded knowledge of cancer. So I know we can get a little lost in the weeds here because cancer is it's confusing. So don't be too worried about this stuff in here. Okay, so when it comes to cell proliferation, so we talked about the two types, two different dysfunctions, either cell proliferation or differentiation. Cell proliferation, it's normally controlled. It'll be controlled by these intracellular mechanisms, so apoptosis, which is cell death. When there is apoptosis, it triggers cell proliferation, so the body's like, oh, a cell died, I need to make more. There's physiologic need for cells. So this would be like if there's an infection or inflammation, then the body senses that we have an increased need for white blood cells. Or there's contact inhibition. So this is where our body kind of respects the boundaries and territories of surrounding cells. So like a muscle cell muscle cells aren't going to start growing into the skin. They realize that like the skin is there for a reason kind of thing. Cancer has some sort of defective response to one or more of these mechanisms, and then proliferation just becomes continuous. They still proliferate at the same rate as normal cells, but it's just not controlled, so it just kind of continues to divide and create. Cell differentiation is the other side of this. So all cells are derived from, a fertilized egg. And then as they mature, they differentiate and can only perform certain functions. Oh, excuse me. Sorry. So as they mature from that fertilized egg, they differentiate, and then they perform those certain functions. So like musculoskeletal cells versus glial cells versus cardiac cells. They all have different functions. And so they mature and stabilize these cells, and then genes will lock the cells into a mature state, and they're not supposed to de-differentiate. Like cardiac cells stay cardiac cells. But what happens is during cancer, they become unlocked from a mutation or an exposure to a carcinogen, which allows the cells to become malignant and de-differentiate. All right, so to develop cancer, there is initiation, promotion, and progression. You need a mutation in the cell's genetic structure or DNA. That's initiation. So it could be that it's inherited from a parent. That happens in like 5 to 10% of cancers. It could be acquired from a lifetime exposure to carcinogens. Then damaged cells can die or repair themselves, but mutation happens if the cell division occurs before this death or repair. Carcinogens can be caught by protective mechanisms sometimes, but if they're not caught, then they can alter that cell DNA. So there's lots of different chemical carcinogens. There's radiation. So certain occupations are at risk for this, like radiology techs. This is also why we try and limit CAT scans for our patients. Viral carcinogens would be like Epstein-Barr virus. HIV can put patients at increased risk for different cancers. HPV, like we talked about, so human papillomavirus, puts patients at increased risk for certain cancers. And then promoting factors are generally things that like they promote the development of cancer, but they can be reversed from lifestyle change. So, they say 40% of new cancer diagnoses in the US are avoidable. A third of cancer-related deaths are related to tobacco use, unhealthy diet, physical inactivity, and or obesity. It's like 1 in 3. And so we really need to be teaching our patients about avoiding some of these things. All right, metastasis. So metastasis is when the cancer spreads to other areas of the body. And so this is kind of the process that it goes through. So it starts as the primary tumor here. And the best way for a tumor to survive is if it gets its own blood source. So it gets its own blood supply to the tumor. It's critical for its growth and survival. And then you can see these little cancerous cells then invade the blood vessels. Okay, so they can travel to other areas via the blood supply or the lymph supply. Most tumor cells don't survive the travel because there's just such turbulence within those areas. But some of them do, and then what happens is they need to set up in another area. So they have to set up that environment to grow, get their own blood supply, that sort of thing. So it takes a little bit of time for metastasis to happen. I don't know where to put my face. Sorry, guys. So your immune system helps with detecting cancer cells. We kind of talked about this back in Unit 1 when we were talking about immunology. So we have like normal cells, and then we have what are called abnormal cells. So we recognize self versus non-self. So our normal cells are like our self cells. And then cancer cells are perceived as non-self or abnormal with their surface antigens here. So immunologic surveillance, this is where those lymphocytes are constantly checking for mutations or bad cells, abnormal antigens, that sort of thing. So they're the ones that will get rid of those cancerous cells. So the problem is that cancer cells can actually evade the immune system through what's called immunologic escape. So they have either like weak surface antigens that can break off, or they secrete products that'll decrease the immune system. Like there's a few different mechanisms that cancer cells will use to kind of lower our immune system's ability to detect these cancer cells. All right, so when it comes to cancer prevention, we want to promote those healthy lifestyles. So a lot of those things we talked about, those promoting factors, we can help with. Stop smoking, limit alcohol use, get regular physical activity, appropriate sleep. Nope, not going to sneeze again. I was thinking about it. Okay. Sunscreen, regular physical exams, testicular exams, digital rectal exams, mammograms, colonoscopies, pap smears, that sort of thing. And then there are these, the 7 warning signs of cancer. That's table 16.6 in your book. That's a nice to know, not a need to know. All right, so a breast self-exam is something that we can teach our patients about trying to help with breast cancer. For those of you who do not have breasts, it's good to educate your patients that this is less painful to do right after the period, right after menstruation. And so there's a few steps that we do. So hands on the hips, and we're looking in a mirror to look, see if there's normal size, shape, color, check for any puckering of the skin or the nipple, checking for discharge. Then we do the same with arms up. Then the patient will lie down and do circles about the size of a quarter in all of the tissue. And so it's not just the breast tissue itself, like we're going up to the clavicle, we're going into the axilla, we're getting collarbone to upper abdomen, and then armpit to cleavage is generally the idea of all the tissue that we want to check. So keeping the fingers flat, doing these nice little circles, just trying to feel for any new lumps, bumps, that sort of thing. And then they also show this standing up in the shower. The book recommended the shower was easier to do because the skin is wet, so it's a little lubricated. I haven't found that to be true, but it could be a good teaching point for your patient. All right, and then you do also want to be familiar with these benign breast disorders for your exam. So mastalgia is breast pain. It can be cyclic with the menstrual cycle, tends to decrease with menopause or as those hormones kind of change. There's also non-cyclic mastalgia. This one would not be related to hormones, but it tends to be like one-sided. Breast infections. So mastitis is that inflammation. It's usually in lactating women. Cured with antibiotics, it is okay for the woman to continue breastfeeding during this. Sometimes, a lot of the times that mastitis will develop from like a plugged duct. And so breastfeeding actually is encouraged to help unplug that duct to get things going. Breast abscess, this is something where it's a pocket of pus that'll develop in the breast. So usually need ultrasound to find where that pocket is, and then they'll do like a little incision to guide the drainage. It's usually okay to continue breastfeeding, but again, follow the doctor's recommendation, and especially it's going to depend on what antibiotics the patient gets sent home on, since some antibiotics are not safe with breastfeeding. There's also fibrocystic changes to breast. This used to be called fibrocystic breast disease or breast disorder, but they've noticed it in about 50% of women, so it's actually not a disease. It's just changes that can happen to the breast tissue. They're well-delineated lumps that are freely movable, not associated with cancer. And then a fibroadenoma is a common cause of benign breast lumps. So it's round, well-delineated, very mobile. When it comes to breast cancer, what we're worried about is the painless, immovable lumps. Those are the ones that we're scared about. So, okay, that's all I've got for you guys for cancer. We'll get into cancer treatments in the next video. Like I said, I know this video can be a little confusing going over the biology. You don't really need to know too much about it for the exam. Besides like knowing the difference between, benign and metastatic, and being familiar with these breast disorders. But otherwise, it just kind of helps lay the foundation for how the treatments work, which we'll get into in the next video.